Hi, my name is Rudiger, and I'm in the Biomechanics class, and this is the second assignment of the semester, and it's about the human body movements. The first one is flexion, and flexion is the bending movement in which the relative angle of the joint between two adjacent segments decreases. Extension is a straightening movement in which the relative angle of the joint between two adjacent segments increases. Rotation is the act of rotating around an axis or a center. Abduction is movement away from the midline of the body, and adduction is movement back towards the midline of the body. Supination is rotation of the hands, and the palms are facing upward. And pronation is rotation of the hands and arms so that the palms face down. Circumduction is circular movement of a segment. Elevation is raising the segment, and depression is lowering the segment. And now I'm going to demonstrate some of these movements. Neck flexion would be chin pointing down, and neck extension would be chin pointing up, and then neck rotation would be a side to side movement. Then shoulder elevation would be shrug up, and then shoulder depression would be shrug down. Abduction of the shoulders would be pulling them as far apart away from each other as possible, and then adduction is squeezing them together. And then flexion would be arm lift up, and then extension would be pushed back, and circumduction is an arm circle. Now for the wrist and the arm, flexion would be arm straight forward, extension would be arm straight down. Supination would be turning the hands in like soup, and then supination, pronation would be turning the hands down, palms down, and then abduction is fingers spread apart, and then adduction is fingers together. And then trunk flexion would be bending at the hip, and then extension would be popping the hip forward, and bending the chest slightly. Rotation is would be sitting and twisting the trunk, so just a movement like this. And then hip flexion would be this, hip extension would be knee back, abduction would be leg away from the midline, and adduction is the leg back towards the midline. Circumduction would be the leg in a circular motion. Knee flexion would be knee bent back, and extension is a straight knee. Ankles, plantar flexion are toes before and heels up. And dorsiflexion is just the opposite, with heels up and toes, or heels down and toes up. And then inversion would be this, and eversion would be the other way. And that is all. Thank you.